My name is Maher Salahi. I'm one of the vascular interventional radiologists with the Radiology Associates of Appleton Group. This is my first year out of training. I grew up in California, in Los Angeles, left for college, did my medical training at Vanderbilt University in Tennessee, spent a year in Seattle at the University of Washington, and then I did my radiology residency in Chicago at the University of Illinois, and then my fellowship in vascular interventional radiology at Stanford University. I chose radiology because, unlike other fields, you talk to every provider in the hospital. You're usually the one that knows the answers before anybody else, and I like that, I enjoy that. We're a minimally invasive procedural field where we do procedures like treating cancer, we stop bleeding, we shrink fibroids, we also remove IVC filters that are in place for a while and that are causing blood clots, and we also remove blood clots in the legs and the belly. My interest is treating cancers in the liver and the kidney with directed chemotherapy. So I go in with a small catheter into the arteries and direct chemotherapy agents to that cancer. I have a very good work ethic. I have good eyes, and so I'm able to see subtle things on imaging, and I hope to provide my ability to see these subtle things to the community of Appleton. The greatest satisfaction is that I'm able to figure out what's going on with the patients. They come into their provider's office with complaints, not knowing what's going on, and with the imaging, I'm able to help the provider figure out what's going on with their patients, and I think that's very satisfying for me. I hope to provide services to Appleton that are usually seen in larger cities, such as chemoembolization, radiofrequency ablation, radiotherapies, any of those types of minimally invasive procedures that we would otherwise have to drive hundreds of miles away to get. I'm hoping to provide here so that we can reduce that inconvenience of going to a larger center.